That's a two-part question. One is healthcare. At which point did I decide that that was a field I wanted to enter? I tossed it around along with being a teacher, a doctor, whatever, as an elementary school student. I was very attracted to biology and to chemistry. And it was actually when I was 16 and my older brother had a very severe spinal accident, and it was at the time in the hospital when I decided this is the kind of work I would like to do. The other part is the rural, and that was less of a conscious decision, more of this is what I love. I grew up in a small community in southern Ontario, so I'm a farm girl by birth. Moved to Winnipeg, to the big city, always longed for the rural area, and had a practice, typical urban family practice, very busy, very fulfilling. Took a little bit of time off when the children were small, and then I thought, I want to do something very adventuresome. I'm just going to throw myself into something, and a position came available in the remote north, and that was 23 years ago next month. I'm still there. So I love the country. I love the rural areas. That's my home. That's where my heart is. And my heart is also in medicine, still after 4+ decades. I love people, and in the rural setting, there's more opportunity for connection, I believe. It's very easy in an urban setting to get very busy and just become very task-oriented, which type A personality, I'm very task-oriented. Whereas in a rural area, I find more opportunity to build the relationships, to build the connection. In terms of the rural, it's nature. I love trees, I love grasses, I love forests, love water. That's how I fill my tank. Fulfillment involves a great deal of self-honesty. And I must admit, I am just starting to grow into that metaphysical concept of self and fulfillment. One has to know oneself. What am I looking for? Am I just sort of bumbling along and, and death is around the corner and that's the end of the line? No, I believe that there's a much greater picture. So fulfillment for me is feeling for that desire to do or desire to accomplish or to desire to be or to help someone, a sense of I'm on my way there and I love it and I want to do more. Stay hopeful. Don't let the state of the world depress you. Try to maintain your energy level as high as you can. Get your rest. I'm learning the hard way. It does catch up with you eventually. So self-care, number one, because you can't care after anyone else. Family, patients, friends, unless you take care of yourself. All women. And I'll use myself as an example. The sky's the limit. That's my advice. Don't allow previous programming to stop you or to limit you. Think outside the box, even if you haven't been exposed to medicine as a potential career. My father died when I was very young, but my mother, even in her era, would probably be called a feminist now, because I have 2 older brothers. Her advice to my older brothers, her advice to me was exactly the same. And that was, if you love something, you throw yourself into it, you work hard, and it doesn't matter whether you're male or female. So I was blessed to grow up with that kind of attitude, where I realized in my era, a woman going into medicine was very unusual, but I didn't find it intimidating. It sort of was a challenge. Well, I can do as as well as those guys. There's nothing stopping me. So I think it's the limitations sometimes that we women put on ourselves, whether it's societal expectations, parental expectations, trauma. And I've been very fortunate that way. I haven't had to deal with a great deal of that. So the sky's the limit. That's my advice. The connection with my patients, and that holds with my previous urban practice, but very, very much so in my remote setting. It's a community of about 4,500 people. A great disease burden, unfortunately, but the connections that I have made and getting to know the families and who's related to whom and what's happened in whose life and you know so-and-so, yes, actually after 20 years I do know so-and-so. So it's the satisfaction of being able to walk into a room with a patient that I've known for years, be able to sit down and we sort of reconnect. And I feel greatly honored that I am actually invited to share in their life to some extent. And that's so satisfying, and it still is.